Ils indiquent qu'il pourrait y avoir jusqu'à 10 000 cas déclarés par jour d'ici la mi-décembre. Nous avons actuellement l'occasion d'agir de concert avec les autorités de santé publique pour aplatir la courbe des taux d'infection. Tout ce qu'on nous demande de faire, c'est d'appliquer les conseils de santé publique de nos autorités locales lorsque des mesures sont introduites pour contrôler la propagation du virus dans la population et de suivre à la lettre nos mesures individuelles de prévention pour aider à réduire le risque d'infection et de propagation du virus. Restez à la maison et isolez-vous si vous présentez des symptômes, même s'ils sont faibles. Lavez-vous les mains fréquemment, respectez la distanciation physique, portez un masque lorsque vous êtes avec des personnes qui ne font pas partie de votre ménage et évitez le bec, les lieux bondés, les contacts étroits et les espaces clos, ou limitez en la durée. Maintenant, plus que jamais, et comme l'ont été nos récents efforts pour adoucir la courbe, ça ne sera pas une solution rapide. Plutôt, cette solution mettra à l'épreuve notre détermination et notre endurance. Comme ce n'est pas le moment de nous réunir, nous pouvons nous consoler en sachant que les sacrifices que nous faisons aujourd'hui sont pour notre avenir. Il est maintenant temps de planifier des célébrations en toute sécurité qui nous permettront tout de même de préserver nos importantes traditions et trouvons des nouvelles façons de célébrer, de rester en contact et de se soutenir mutuellement. Faisons preuve de résilience et de détermination et concentrons-nous sur ce que nous pouvons faire, soit déployer tous les efforts possibles pour protéger notre famille, nos amis et notre collectivité. Merci.
Thank you, Dr. Njoo. I would like now to invite Minister Marc Miller, Minister of Indigenous Services.
Merci Jean-Yves. Good afternoon, bon après-midi. We continue to see an alarming increase in COVID-19 cases across Canada and Indigenous communities. We've seen a number of outbreaks in regions that had fared well during the first wave of this pandemic. First Nations, Inuit and Métis in regions such as Manitoba, Saskatchewan, Alberta and Nunavut are experiencing an active infection rate that is close to 4 times the total number of Indigenous peoples infected by COVID-19 during the first wave. This is exceedingly serious. To ensure Indigenous groups and communities have resources they need to successfully prevent, respond, and limit the spread of COVID-19, particularly in those 4 regions, we have recently allocated over $200 million in immediate funding. Just this week, we allocated $19.3 million for efforts in Nunavut to support the various priorities identified by leadership and communities, including support for vulnerable populations, support for long-term care homes, deploying additional staff in communities with outbreaks, strengthening mental health services, and additional isolation and screening spaces where needed. Nous avons également octroyé 120 millions de dollars pour soutenir les communautés et organisations autochtones de l'Alberta et de la Saskatchewan et 61 millions de dollars en financement immédiat pour soutenir les Premières Nations du Manitoba et leur réponse sur le terrain. Nous continuerons d'appuyer les efforts déployés sur le terrain pour veiller à ce que ces personnes, les communautés et les organisations autochtones disposent des outils nécessaires pour atténuer les répercussions de la COVID-19 sur leur santé et leur vie. As we approach the end of the year, we are also approaching the 1 year since the Act respecting First Nations, Inuit, and Métis children, youth, and families came into force. This historic legislation was co-developed with Indigenous partners to reform child and family services with the aim of reducing the number of Indigenous children in care, as well as enable First Nations, Inuit, and Métis to exercise their jurisdiction over child and family services so that they can decide what is best for their children, their families, and their communities. In order to thrive and fully reach their potential, children and youth need to have solid supports and resources, strong ties to immediate and extended families, as well as ties to their home community and cultural connections. Sadly, this is not the reality for far too many Indigenous children. According to the 2016 census data, Indigenous children make up over half of all children in foster care, even though they only account for less than 8% of all children aged 0 to 14. But behind these devastating numbers, there are real children, real and terrible stories, and these stories shouldn't happen to anyone, much less to innocent children. The overrepresentation of First Nation, Inuit, and Métis children in the child and family services system has been described as a humanitarian crisis. It is a crisis, and anyone who has seen the groundbreaking reporting of Kenneth Jackson knows that this is an ongoing crisis, but it's a crisis that we must have the courage to address head-on. That is why First Nations, Inuit, and Métis communities are best placed to determine their needs and ensure their children, youth, and families thrive. Today, Prime Minister Trudeau announced an investment of over $542 million to advance the implementation of the Act. It's an important next step for the full and successful implementation of the Act. It will ensure that it is funding First Nations, Inuit, and Métis groups to work within and across their communities to build strong foundations and support them in engaging communities and hiring experts to develop models and legislations. In addition to this funding, and in order to provide initial support, a first wave of funding totaling $12 million was already allocated to 26 First Nations and Inuit groups, which had identified an immediate need to begin their work and explore Indigenous-led children and family services delivery models. We will continue to engage and work with partners to identify needs for funding that support their jurisdiction over child and family services. We also need to recognize that the uncertainty that COVID-19 brings to youth that would normally age out of care during this time. To make sure that they get the support they need, we will continue to cover eligible costs for First Nations, child and family service agencies providing services to youth who would normally be aging out of care during this time, and do so as long as the pandemic lasts. Les enfants et les jeunes sont des symboles d'espoir pour un avenir meilleur. Ils nous mettent au défi de faire mieux, de sortir des sentiers battus et d'innover. Pour s'épanouir et atteindre pleinement leur potentiel, ils ont besoin de soutien et de ressources stables, mais aussi des liens familiaux et communautaires solides qui incluent une connexion significative avec leurs langues et traditions. La surreprésentation des enfants des Premières Nations, Inuits et Métis dans le système des services à l'enfance et à la famille a été décrite comme une crise humanitaire. Elle en est une. Il faut savoir et avoir le courage de s'attaquer à cette crise, à cette discrimination systémique. Le financement de 542 millions de dollars annoncé aujourd'hui, en lien avec la loi concernant les enfants, les jeunes et les familles des Premières Nations, des Inuits et des Métis, est une étape essentielle pour rectifier nos erreurs du passé. Nous savons qu'il reste du travail à faire, qu'il faut faire plus. Nous continuerons à travailler avec les partenaires autochtones afin d'évaluer les besoins en matière de financement à long terme et d'y répondre. All of this work is about putting First Nations, Inuit, and Métis children first so that they can stay with their families and communities and grow up immersed in their cultures and have greater opportunities to thrive and reach their full potential. This is not a promise that I or the Government of Canada take lightly. There's no doubt that we still have a long way to go, but this is an investment and it is a key step in the right direction. A step towards keeping our promise to Indigenous children and families and to unleashing the potential that I have no doubt will change our nations and our world for the better. Miigwech, Nakumik, Merci Cho, thank you, merci.
Merci beaucoup, Marc. We would now want to invite Dr. Tom Wong, Chief Medical Officer of Public Health at Indigenous Services Canada.
I want to acknowledge that I'm on the unceded territory of the Algonquin people. As of November 26th, 1,392 First Nations on reserve active COVID cases have been reported. And this compares to over 60,000 active cases reported in the general Canadian population. Sadly, there have been 30 on-reserve fatalities, with a case fatality rate that's a quarter that of Canada's. Canada has reported over 11,000 deaths. Nous reconnaissons la valeur de l'accès, la collecte et l'analyse de données ventilées et menées par les Autochtones. Cela contribuera à soutenir les communautés des Premières Nations, les Inuits et les Métis, à promouvoir des approches culturellement adaptées et fondées sur l'évidence. Par exemple, nous soutenons les efforts pour renforcer les capacités de gouvernance des données des Autochtones, comme le financement accordé au Centre de gouvernance de l'information des Premières Nations pour les efforts à la COVID-19. The recent troubling spike in cases and deaths in the general Canadian population and in Indigenous peoples is heartbreaking. This calls for our collective efforts to listen to the elders, to redouble our public health efforts, to limit non-essential travel, practice hand hygiene, stay 2 meters apart from people not within our household bubble, wear a mask, avoid gatherings, stay home if we are sick, if we are infected, or if we are in isolation. And most importantly, be kind, support each other, and do everything we can to protect our elders. We are in this together. Miigwech, Nakumik, et Marcy.
Merci, Dr. Wong. Comme on le disait tout à l'heure, la ministre Anand, virtuellement, et la ministre Hajdu, en personne, seront aussi très heureuses de répondre à vos questions.
Thank you, Minister. As usual, we're going to start on the phone. One question, one follow-up, and we will then turn to the room. Operator, over to you.
Thank you. The first question is from, la première question est de Lina Dib de la presse canadienne. Please go ahead, à vous la parole.
Oui, bonjour. Ma question est pour vous, Dr. Njoo. La semaine dernière, mardi, vous nous avez dit que vous espériez que la grande majorité des Canadiens soient vaccinés avant la fin de l'année prochaine. Je m'entends en écho, c'est un petit peu troublant. Et ce matin, M. Trudeau vient nous dire, il y a à peine une heure, qu'il pense que la majorité des Canadiens vont être vaccinés d'ici septembre. Alors, je voulais savoir d'où vient cette prévision de M. Trudeau. Est-ce que c'est la vôtre? Est-ce que vous êtes devenu encore plus optimiste que vous l'étiez la semaine dernière?
OK, merci. Merci pour la question. C'est sûr que l'objectif est toujours de vacciner ou au moins offrir la vaccination à la plupart des Canadiens pour la fin de l'année prochaine. Moi, j'ai été optimiste. Je pense que j'ai constaté comme le but, l'objectif il y a une semaine ou deux. Et le premier ministre a peut-être mieux précisé. C'est sûr que c'est toujours, comme on dit, un projet avec des ajustements à faire, mais aussi avec le support maintenant, aussi avec le major général Fortin qui fait partie de notre équipe. C'est sûr qu'on est aussi même mieux placé maintenant pour organisé pour la vaccination pour les Canadiens. C'est sûr qu'il y a aussi des inconnus parce que on est en train encore de faire l'approbation. Nos collègues de Santé Canada, ils doivent encore réviser toutes les données probantes des essais cliniques qui sont soumises des Pfizer et de Moderna. Et puis, nous autres, on attend aussi avec un optimisme les autres 5 candidats vaccins qui peut-être si ils ont aussi des bons résultats, ils sont approuvés. C'est sûr, peut-être on peut avoir toute une sélection des vaccins. Et c'est difficile maintenant pour moi de dire exactement c'est quoi peut-être l'horaire pour la livraison, tout ça pour les vaccins, parce qu'ils ne sont pas encore approuvés. Mais en général, je suis d'accord avec le premier ministre. On attend que peut-être la plupart des Canadiens vont être aussi au moins capables d'accepter une vaccination peut-être en automne ou vers la fin de l'année prochaine. Merci.
OK. Si je peux,
Lina, juste un instant, Monsieur Dr. Njoo va répéter en anglais d'abord.
Regarding sort of the schedule for vaccination, certainly we've always been sort of optimistic, cautiously optimistic about what the vaccination rollout will look like. I think I said about a week or so ago that certainly by the end of next year, we would hope to offer vaccination to the majority of Canadians. I think the Prime Minister this morning or today sort of elaborate further, and I think he mentioned maybe a date of September. I think it's all in the same ballpark. I keep using my sports analogies in the sense that right now it's a bit of a moving target. We have 2 vaccines which are very promising, but they're still in the process of, quote, going through the regulatory process. If all goes well and they are approved, then they're the first 2 out of the pipeline. What we also anticipate is that with the other 5 candidates that we have, if all goes well with the results of the clinical trials and the data coming in and so on, and they get approved, then we will have really what they say a suite of vaccines to be able to offer Canadians, because we do have obviously advanced purchase agreements for all of these vaccines. And with all that in play, it's still, I think, a bit of an unknown. There's lots of moving parts in terms of what the schedule are, delivery, et cetera, and so on. But certainly, I think a major addition as well that the Prime Minister announced today is with the addition of Major General Danny Fortin to our team, I would say, Team Canada, to hopefully, like I say, bring this all together, certainly focusing on the logistic aspects. I think I mentioned last week that the Canadian Armed Forces certainly bring a unique expertise in the field of logistics, and we're looking forward to having them on board.
Lina, suivi?
Merci. Juste pour être clair, Dr. Njoo, cette idée d'ici septembre, parce que septembre, c'est encore l'été, hein, l'été finit le 21 septembre, quand M. Trudeau dit d'ici septembre, la majorité des Canadiens seraient vaccinés.
Oui, je suis toujours d'accord avec notre Premier ministre. À l'échelle technique, on continue à travailler étroitement avec nos homologues des provinces et territoires. Il y a beaucoup de monde qui travaille très fort derrière les scènes, et c'est sûr que c'est bon d'avoir un objectif pour peut-être planifier pour une date le mois de septembre, mais je pense que pour aussi être un peu réaliste, je peux aussi vous dire que oui, moi j'ai dit que oui, la fin le mois de décembre, c'est sûr, mais si on peut faire ça plus tôt, c'est bon pour tout le monde.
Thank you, Doctor. Operator, next question, please.
Thank you. The next question is from, la prochaine question est de Janice Dixon from the Globe and Mail. Please go ahead, à vous la parole.
Hi, my question is for Dr. Tam. Why did Canada update its guidelines on aerosol spread in November after other countries and international organizations?
So aerosol is, I think we have to recognize there's a range of droplet size when someone coughs, speaks, sing loudly. Aerosols are the smaller of range and can get suspended in the air for longer. So just to set the stage. And we have, since probably June, been advising on, avoiding and minimizing close contact, close spaces, poor ventilation, and crowded spaces as well. So really, that's the key, and also, of course, wearing a mask. So I think from that perspective, we've always recognized that there's always a range of unknowns, and that the public health advice had been provided as early as that point in time. There's much in the way of evolving science and knowledge. And so in the Canadian context, many experts have been discussing this for quite some time. And so as a result, one of the key updates is because we're about to move into a time when everybody is going to have to gather inside and not sort of stay it's more difficult to stay outside. So the emphasis on doing as much as we can to reduce the risks of transmission in those are the 3 Cs, add to a few more Cs, continuous exposures, a longer duration of exposure, and others is the key. So that doesn't change. What we are also trying to do, we've given some preliminary advice, which is just make sure your HVAC is well maintained. Open a window, go outside if you can, even in the winter. And in Canada, we can do that in the winter too. You can still go outside whenever possible, are the key advice. But we'll continue to work with experts who are more in the field of ventilation and update or get them to update guidance and approaches accordingly.
Janice, follow up? Janice? Okay. Operator, next question, please.
What? Perfect. The next question is from, la prochaine question est de Émilie Bergeron from Agence QMI. Please go ahead. À vous la parole.
Oui, bonjour. Monsieur Trudeau, ce matin, a parlé de la majorité des Canadiens vaccinés en septembre, mais il a aussi dit en anglais plus de la moitié. Donc, est-ce que ça veut dire que en septembre, on s'attend à ce que un peu plus de 50% de la population canadienne soit vaccinée, ou est-ce qu'on pense plus à 80% ou plus?
Merci pour la question. C'est Dr. Njoo encore. Je pense que c'est vraiment difficile à préciser comme des chiffres exacts. Je pense que le premier ministre il est encore optimiste, et moi aussi. Je pense qu'il y a beaucoup des inconnus, comme j'avais déjà constaté. Même aujourd'hui, on n'a pas des vaccins approuvés au Canada. C'est ça, la chose la plus importante, c'est d'avoir les vaccins sûrs et efficaces ici au Canada, approuvés par nos collègues de Santé Canada. Avec l'approbation peut-être des 2 vaccins, on parle toujours de Pfizer et Moderna, on est en train de peut-être avoir une livraison peut-être de 6 millions de doses, peut-être en janvier, février. Et on va commencer avec la vaccination, au moins offrir la vaccination aux groupes prioritaires comme les personnes vulnérables dans les établissements de soins de longue durée, peut-être les travailleurs essentiels comme les travailleurs de soins. Mais à part de ça, c'est difficile parce que si on parle de septembre, décembre, c'est vraiment plusieurs mois à l'avenir. Et comme j'avais aussi dit, on a aussi comme 5 autres vaccins candidats. Il faut aussi voir qu'est-ce qui se passe avec les résultats de leur essai clinique, aussi avec le processus, avec l'approbation, tout ça. Donc, je pense qu'il y a beaucoup des inconnus et on ne peut pas préciser un mois exact avec quel pourcentage de la population. Mais je pense que, comme j'avais aussi dit, c'est aussi une autre bonne étape de voir aussi, le support aussi de nos forces canadiennes avec le major général Denis Fortin qui fait partie de notre équipe, l'équipe Canada, pour aussi réagir avec tous les enjeux logistiques parce que ça fait partie de notre, programme de vaccination. Mais ce n'est pas seulement le gouvernement fédéral, on dit toujours, c'est toujours en étroite collaboration avec nos homologues des provinces et territoires et aussi les chefs des organismes autochtones. Donc, c'est vraiment, je pense, un effort, ça prend tous les secteurs, tous les intervenants, toutes les échelles de gouvernement, les ordres de gouvernement du Canada. Merci.
Émilie, en suivi?
Oui, aussi pour Dr. Njoo. Hier, vous avez dit que c'était optimiste, votre projection, que la vaste majorité des Canadiens soient vaccinés d'ici la fin de l'année. Donc, comment qualifieriez-vous la projection faite par M. Trudeau ce matin que ce serait la majorité d'ici septembre, donc avant même le moment que vous aviez vous-même évoqué et que vous avez qualifié d'optimiste?
Moi, je pense que ce que le premier ministre a dit ce matin, c'est bon, parce que c'est toujours au moins comme une cible, quelque chose, tout le monde, il y a beaucoup de monde au sein du gouvernement fédéral, mais aussi avec nos homologues des provinces et territoires. Si le premier ministre a dit peut-être comme un objectif le mois de septembre, c'est correct parce que nous autres, on continue à travailler fort pour finalement être capable d'offrir la vaccination à la majorité des Canadiens. Donc, si c'est septembre, décembre, pour moi, c'est comme quelques mois, mais c'est sûr qu'il faut continuer avec nos efforts maintenant.
Merci, Dr. Njoo. We'll now turn to the room, starting with Mackenzie.
Hello, everyone. Mackenzie Gray from CTV News. First part of my question is for Minister Hajdu and Dr. Tam. Was there any consideration to use either the GlaxoSmithKline plant in St. Foy or the Sanofi plant in North York to produce vaccines domestically? And in the same vein for Minister Anand, why did none of the 7 vaccine contracts that we have any option for Canada to use the IP that the vaccine companies have had to domestically produce vaccines once we get to that capacity?
I think I'll start and then turn to Minister Anand. Thanks for the question, Mackenzie. And I think the Prime Minister said it well when he described the loss of biomanufacturing capacity in Canada over the past several decades. And of course, given that, we knew that we had to be aggressive in securing options for Canadians of vaccines that would represent a variety of different kinds of vaccines and also a variety of different manufacturers. And we didn't do that alone. We used the Vaccine Task Force to guide our work. In fact, these are hardworking volunteer Canadians who are volunteering to help their country. They're experts in pharmaceutical industry, in virology, scientists and researchers that are providing advice to Canada. And that's why we're so well positioned with this portfolio of very diverse vaccines, but also very promising ones. In fact, we were the first country in the world to have all three that are showing effectiveness now under regulation in the world. So and now there are other countries that are reviewing all three, but we were the first country in the world to have submissions from those three companies. It just, I think, speaks to the quality of advice that we've received from the Vaccine Task Force. And I'll turn to Minister Anand for the rest of your question.
Thank you so much, Patty, and thank you for the question. When we entered into agreements for vaccine candidates in August, September, and October, based on the recommendations of the Vaccine Task Force, we of course took into account Canada's production capacity. One of the key criteria involved in the negotiation of the contracts was what would provide Canadians access to vaccines as early as possible. While we explored the possibility of domestic manufacturing with a number of vaccine developers, the quickest path to supplying vaccines to Canada would be from their international supply chains. At the same time, Canada also made significant investments to rebuild our biomanufacturing capacity, for example, by investing $126 million into the NRC's Royal Mount facility, as well as in Medicago and Vito Intervac. So I'd like you to think about it as a two-track process. First, ensuring that we have a diverse portfolio of vaccine candidates, which we have now secured, with the most doses per capita of any country in the world for Canadians. And second, to, at the same time, bolster domestic manufacturing, make sure we are investing in domestic facilities so that we are not precluding the domestic option, but we are ensuring that Canadians have access to vaccines as soon as they are approved by Health Canada. Thank you.
Many other countries have been able to outline quite clearly the delivery date for vaccines. So for Minister Anand, in the contract with Pfizer, can you tell me the earliest date that Canada could receive a vaccine? And if you can't tell me, why did we sign a contract that cannot give such basic information out to Canadians?
Well, thank you for that question, and I want to make sure that we put these deliveries in context. We should and must think about the inoculation of all Canadians, not only the first Canadian. And that is exactly what the Prime Minister was suggesting in his remarks this morning. Having said that, and as a former professor of contract law, I can assure you that we put in place contracts with Pfizer and Moderna and the other suppliers that indicated once we have Health Canada approval, deliveries will start as soon as possible. The most important thing to remember, and we've been consistent about this at the outset, is that we can expect deliveries in the first quarter of 2021. And we put contracts in place with these 7 developers to ensure that Canada has the greatest access of any country in the world to the most diverse portfolio of vaccines in order to ensure that Canadians are well placed, and indeed now better placed than any other country, for access to vaccines. And in terms of your question regarding a precise delivery date, I want to indicate that it is very important to remember that we put these contracts in place, recognizing that there may be uncertainty around the timing of the discovery of a vaccine, which we are still waiting for, and the finalization of approval from Health Canada. Those are 2 points that are uncertain in time. And we are constantly in touch with our suppliers, me included, almost daily with our suppliers to ensure that when Health Canada approval is forthcoming, we can then roll out vaccines to Canadians. This is a complex process. This is an uncertain environment, but we are on top of it. And I personally will make sure that we have vaccines in place in Canada once Health Canada has provided its regulatory approval. Thank you.
Thank you, Minister. David?
Hi, David Thurton, CBC News. Dr. Njoo and the Prime Minister have both said that they are hoping to vaccinate the majority of the Canadian population by the end of next year. So, Dr. Tam, can you tell us what level of vaccination do we need to see in Canada to protect Canadians against COVID-19? Is it 50%? Is it 60%? What is the success rate? What's the uptake rate that you need to see?
There's 2 aspects to the objective of immunization. Obviously, the first is to protect the individual. So some of the data that would be submitted to the regulator is about the effectiveness and safety for the individual that's getting the vaccine. As far as I know, we will not necessarily get any data about the effectiveness of the vaccine against transmission to someone else. So that's another kind of information that would be required. So I think, and the immunology, the immunity of the human body to both the virus and the vaccine is still being studied. Having said that, you know, another key objective is we hope that by vaccinating large number of people who would get the vaccine, that you might be able to protect others. So that's the concept of herd and community immunity. I don't think anyone has an actual precise number for that. There's all sorts of modelers who are sort of projecting different levels. In general, you just want as high as possible. And it depends. Every vaccine has a different characteristic, and we don't know enough about the vaccines coming out as yet. So that would be the most sort of reasonable answer, I think. But the Health Canada and other regulatory threshold is not about a herd immunity threshold. That is about vaccine efficacy or effectiveness for those who are receive the vaccine versus those who don't. So I think we will come back to you with that answer. You hear lots of opinions, but I think right now we don't know the exact answer to that question.
So bear with me here. I've just got a text from my French colleague, Minister Anand, if you could repeat your question to CTV in French. But before we do that, just another question, and this is maybe for Dr. Tam or possibly for the Health Minister, Ms. Hajdu. What's going to be the basis for deciding how many doses each province, each territory, each nation, or Indigenous community gets? Is it going to be population size? Is it going to be the severity of the spread? Is it going to be even perhaps, how many people of elderly people are in that region. What are we thinking about at this point? Where's your head at this point?
Thank you very much, David, for the question. And these are exactly the conversations that are happening right now with health ministers. How we fairly allocate the doses, especially in the first quarter when we don't have very many doses. I think it'll become less of a pressing issue as we hope to receive more doses as the vaccines arrive and as they are approved. But certainly we are being guided, all of us, by the National Advisory Committee on Immunization, who, as you know, released some very broad general criteria about who likely should receive the vaccine first. Provinces and territories will also then do their own assessments within their own immunization programs about their own prioritization. In terms of the allocation of each province and territory, those conversations are ongoing right now with health ministers, so I can't be conclusive on that, but only to say that I'm listening intently, and obviously Canada will reserve some doses to vaccinate the populations for which we have responsibility.
Minister Anand, if you could repeat the question to CTV's last question in French, please.
D'accord. Nous avons été cohérentes dès le début. Le Canada a négocié avec acharnement les calendriers de livraison prévus dans les accords que nous avons conclus pour les principaux candidats vaccins COVID-19 du monde. Nous avons des garanties que les premières livraisons arriveront au cours du premier trimestre de 2021 et, à mesure que la science progresse, que le processus d'examen réglementaire avance et que la production de vaccins s'intensifie dans le monde, nous continuons à collaborer régulièrement avec nos fournisseurs pour que les Canadiens y aient accès le plus tôt possible. Le Canada est très bien placé avec le portefeuille de vaccins le plus vaste et le plus diversifié au monde. Et comme indiqué, nous continuons à nous engager avec les fournisseurs afin d'obtenir les dates de livraison les plus proches possibles. Bien que nos accords prévoient des dates précises, nous devons tenir compte d'un certain nombre de variables qui figurent dans les délais de livraison, ce qui déterminera quand exactement le Canada recevra les premières doses de vaccin COVID-19. Cela inclut, par exemple, la montée en puissance de la capacité de production du fournisseur, ainsi que l'avancement des essais cliniques et donc l'avancement du processus d'examen réglementaire. C'est pourquoi nous continuons à être transparents et responsables dans la façon dont nous traitons les délais de livraison. Il y a sans aucun doute des pressions pour avancer à la vitesse de la politique, mais nous ne précipiterons pas la science, car la santé et la sécurité des Canadiens seront toujours notre première priorité. Merci beaucoup.
Merci, Madame la Ministre. We'll take one last question in the room from Tonda, and we'll switch back to the phone. We have a hard stop at 1:30, so we might not have time to come back to the room after the next round on the phone. Tonda.
Hi, thanks. Tonda McCharles, Toronto Star. Before I get to something I want to ask, I just want to get some clarification on the answer to Mackenzie about asking the companies we've signed contracts with for permission to manufacture in Canada. Minister Anand, did you actually say that, I just want to make sure I understand it, that those companies, did they refuse you that permission to license to manufacture in Canada, and were they the ones that said, you're better off just buying it from us?
Listen, Tonda, thank you so much for the question. I want to be clear that we took an all-out approach in our contracting. We explored every possibility with these suppliers. including making sure that they knew we would be open to any option relating to domestic manufacturing as well as international agreements. Our approach was to put agreements in place for the greatest access for Canadians to vaccines as quickly as possible. And just to be clear, we were the fourth country of all countries in the world to get an agreement with Pfizer. We were one of the earliest countries to secure an agreement with Moderna. In fact, the managing director of Moderna's Canadian unit yesterday in Reuters was reported to have said Canada is certainly one of the first countries to have an agreement with us and will be serviced very quickly. And then with regards to AstraZeneca, we are the first country that they signed with that did not have a large-scale biomanufacturing facility. And that is a very important point to remember, that our aggressive approach to contracting, our aggressive approach to a multi-pronged negotiation with multiple suppliers at the same time yielded an incredible portfolio which will serve Canadians well in the short and the long term. 414 million doses in total will be in very vast number for Canadians if we choose to exercise our options. And I want to stress the incredible work of the public servants over the last 3 to 4 months, especially in the negotiation of these contracts that, as I've mentioned, have placed Canada at the forefront of vaccine procurement in the world.
Okay, I guess that's not going to be clarified. So I'll just move on to maybe vaccine hesitancy, I think, is something that you're all concerned about, and confidence in these vaccines that you're bringing forward. Given that a couple of them are the very new mRNA technology, and given that you're getting the military involved now, I don't know if you can talk about, do you foresee the military being involved in administering vaccines? And can you talk about what your concerns are around public confidence with that, not just that image, but the whole ability to receive vaccines, especially when we've got these very high-tech new platforms? Thanks.
So I think just want to emphasize again that we have a rigorous regulatory process. Many people have just heard about the results of these vaccine trials essentially through the media, and that's not how we evaluate vaccines. And so the regulator, and also in peer review, we would expect to see the data not just on the efficacy, but on safety outlined. Now, these phase 3 clinical trials are testing tens of thousands of people in each of them. So we will get a good idea about the safety of the vaccines as they go through regulatory approvals. After that, Canada also has a very robust foundation for detecting vaccine safety signals or reports, which are then channeled to the regulatory authorities, also through public health to the Public Health Agency, where we will review any kind of incident very carefully and take action accordingly, which means that we will be monitoring the effectiveness and the safety of these vaccines throughout their deployment as well. And so I think some of the, our engagement with Canadians, often through successive surveys or polling, has indicated that, yes, I'm sure they welcome the speed of which we're getting the vaccine, but they want to know that they are safe. So I think that's the really important aspects, and we need to be able to communicate what we find along the way with Canadians as we get that kind of data so that they can be informed. And so I think that goes a long way. And there are many ways of which we are also gearing up to increase communications to Canadians so that they have the information that they need. One is to actually equip healthcare providers so that they have the information as we have them, so that they can counsel their patients whether they be pharmacists or health, physicians or nurses, so that they are equipped to provide that information, which I believe is really important. And there are other strategies also to engage different groups with Minister Miller and others to engage Indigenous communities as well. So that's really important to vaccine hesitancy. In terms of, the military engagement, right now, through Major General Danny Fortin, they are there to support us with logistics. So a lot of their skill sets are put to bear there. We have not received any requests specifically on other supports, but we'll be open to sort of evaluate them if provinces need further support for immunization. They've just gone through a huge influenza vaccine campaign. We know we've got the ability in Canada to provide, just in the last weeks, 16 million doses of influenza vaccine. These vaccines aren't going to go roll out that fast. So there'll be very thoughtful processes put into place on how these vaccines are going to be administered. So I'm sure the Canadian Armed Forces is ready to help, but right now their skill set is put to bear on the logistics.
Thank you,
Dr. Njoo. I was just going to add and reemphasize the points that Dr. Tam made. I think overall Canadians, recognize that we have one of the best vaccine systems, I would call it, in the world. And that starts right with the regulatory process. I think Canadians can rest assured that any vaccine that gets approved in Canada has gone through a rigorous review, and the safety and effectiveness have been proven. And so we look at all of the childhood diseases in Canada, the coverage rates for the vaccine. We have a well sort of built-in infrastructure for the delivery of vaccines in general, including influenza. So now the new wrinkle is that with the COVID-19 vaccine, especially the two new candidates, as you mentioned, they are new technologies, and they have some unique logistical aspects in terms of obviously the cold chain. And that's where I think the Canadian Armed Forces can really bring value in terms of the logistics for the delivery of this sort of unique set of circumstances. But once that's there and they're actually delivered to their provinces and territories, certainly the expectation at this point and the planning will be that with the existing infrastructure, the actual putting needles into arms will rest largely with the provinces and territories as the way they have been for other vaccines. And certainly if we get other vaccines down the road that are sort of similar to the vaccines we're used to in terms of the cold chain being kept between 2 and 8 degrees Celsius, they would be delivered and administered with the existing infrastructure compared to all the other vaccines that we have at our disposal today. Thank you.
Thank you, Dr. Njoo. On va maintenant retourner au téléphone. Opératrice.
Thank you. The next question is from, la prochaine question est de Ryan Tumulty from National Post. Please go ahead. À vous la parole.
Yeah, hi there. The NRC facility in Montreal, that was the initial funding that was announced, the $44 million that was announced early in the spring, was supposed to have a facility set up in November. I understand that was for the CanSino vaccine, which we eventually didn't go ahead with. But I'm wondering, it seems like the focus was maybe lost on the facility because now it is not scheduled to be ready until sometime next year. I'm wondering if you were getting regular updates on that facility, or if after the CanSino vaccine fell through, that facility was no longer seen as valuable.
Anita, would you like to answer the question?
Well, thanks, Ryan. Minister Baines led on this file with the Prime Minister, and the intention was to ensure, and it is to ensure, that we can do domestic manufacturing, $126 million to the Mount Royal facility to ensure that we can yield 2 million vaccine doses per month when it is up and ready. The understanding was that it would not be immediately available as a facility, and the intention is for it to be up and running. The issue of which vaccine would be produced there is not in any way resting on CanSino. We are still in negotiations with our suppliers as to which vaccine will be manufactured there, and that's part of our ongoing negotiations every day. Thank Thank you.
Follow-up?
Yeah, just as a follow or another question, I guess. In your vaccine contracts with the 7 suppliers that make up this broad portfolio, was there any option that Canada did not exercise to potentially spend more to speed up our delivery of vaccines?
Well, thanks again for the question. I want to assure you that since the very beginning of these vaccine contract negotiations, we have left no stone unturned. We have made sure that we are aggressively pursuing the earliest delivery options. We are aggressively pursuing the maximum doses that the supplier would allocate to Canada. We are aggressively pursuing every angle relating to production. And as a result of those aggressive negotiations, we have, as you know, ended up with the most doses per capita of any country in the world, with very solid contracts yielding very strong candidates for Canada, as Minister Hajdu mentioned. We're the only regulatory body currently reviewing all 3 of the leading candidates. So, Ryan, that is the state of the nation on the contracting process. Thank you.
Thank you, Minister. Operator, one last question on the phone. That's all the time we'll have for today.
Thank you. The next question is from La prochaine question est de Lawrence Martin from Radio-Canada. Please go ahead. À vous la parole.
Oui, bonjour. La question est peut-être plus pour le ministre Duclos. Je me demandais si au moment de la distribution du vaccin, il y a des défis logistiques dans des provinces comme le Québec, l'Ontario. Est-ce que l'armée canadienne pourrait intervenir pour aider à relever ces défis?
Merci beaucoup. Tout d'abord, je ne suis pas un expert des enjeux logistiques de vaccination à travers tout le pays. Ce que je sais, par contre, et ce que j'entends du Québec, c'est qu'au Québec, on a depuis longtemps un solide système de gestion et d'administration des vaccins qui fonctionne très bien. Et par conséquent, nous avons toutes les raisons de croire qu'avec la collaboration et l'appui du gouvernement canadien, nous allons livrer et administrer les vaccins dans les meilleures conditions possibles. Sur la question des forces armées canadiennes, mais comme vous l'avez vu ce matin, mais ça se prépare depuis plusieurs semaines et depuis plusieurs mois, les forces armées canadiennes vont prendre un rôle significatif dans le Centre national des opérations du gouvernement canadien. Le major général Fortin va être en charge de la logistique de la vaccination. Et comme ça a été le cas avec les CHSLD au Québec, les forces armées canadiennes seront toujours là pour aider le Québec et les Québécois à recevoir ce dont ils ont besoin dans le contexte de la pandémie de la COVID-19. On l'a vu avec les CHSLD, ça peut prendre différentes façons. Il y a évidemment la logistique purement matérielle, l'équipement, les véhicules, les avions même, qui peuvent être utilisés par les forces armées pour appuyer le gouvernement du Québec au moment et de la manière dont le gouvernement du Québec voudra bien spécifier et solliciter. Il y a aussi les ressources humaines. Évidemment, les forces armées canadiennes ont aussi, comme on l'a vu avec les CHSLD, des ressources humaines médicales qui peuvent aussi servir pour les opérations de vaccination. Mais tout ça doit évidemment se faire en discussion et en collaboration avec le gouvernement du Québec.
Laurence, on suivi?
Oui, juste une dernière question. Vous y avez touché en anglais, mais j'aimerais ça vous entendre en français là-dessus. On voit que certaines provinces en ce moment sont beaucoup plus durement touchées par la COVID-19. Est-ce que le vaccin va être distribué au prorata de la population dans les provinces? Ou est-ce que s'il y a une province ou un territoire qui est plus touché, je pense au Nunavut par exemple, est-ce qu'il pourrait recevoir le vaccin en premier?
Dr. Njoo?
Merci pour la question. Nous sommes encore en train d'avoir des discussions avec nos homologues des provinces et territoires. Tout le monde a reçu les recommandations de notre comité national consultative national d'immunisation avec les groupes prioritaires et je pense même le Québec aussi, je pense élaborer leur population prioritaire. Donc, je pense que c'est une combinaison. C'est sûr qu'on considère la population de chaque province et territoire, mais les autres facteurs comme les populations prioritaires font partie aussi de nos analyses et nos discussions.
Thank you, Doctor. That's all the time we have for
Dr.
today.
Tam.
Ceci met fin à la conférence de presse. I'm sorry. We really have
Excuse
to
me,
go.
Dr. Tam. Can you stay for a couple more questions after ministers leave?
Sorry, that's all the time we have today. Sorry.